Hey.
Hello guys, welcome back to my channel. If you're new here, you're very welcome. My name is Bonte Naisavie. You know your girl, your shy girl but full of courage.
I have to do You have to start.
I'm not starting, it's okay. Don't worry.
Sure.
You did it. I'm very sure. So guys, if you don't know me, my name is Bonte Naisavie. So we couldn't finish the October month without doing the breast cancer awareness video. We can't do that. So I have my friend here.
Hi.
Should I let her present herself? Can you guys see how pretty she is? So what's your name?
Hi, my name is Brilliant.
What's your age?
I'm 22.
Ah! I'm joking.
What?
I thought it was serious.
Wait, let me blow a video.
Where do you live? I'm joking. I just do your presentation.
I live in Nakuru.
For real, you actually answer. You don't go, okay. What else? Let's see. Just do your presentation.
Okay.
Don't mind my
What
questions.
do you want to say
Anything.
about myself? Hi, my name is Brilliant Kayanze Kitinga. Bonte is my friend, and I am honored to be here to talk about the breast.
Anyway guys, I hope you watch this video till to the end, and forgive my smiling. I'm smiling too much. This is what happens when you have people like brilliant around you. Exactly. So guys, yeah, watch till to the end of this video, and do not forget to do what? To check your breast.
Like,
Oh, yes,
subscribe,
exactly.
and comment.
And comment. Yeah. Watch the video to the end. Don't forget to check your breast. Either if you're a man or a woman or a female or a male, you have to check your breast. Everyone can get breast cancer. So yeah, let's get into the video. Guys, what is breast cancer?
Breast cancer is when there is an abnormal growth in the breast tissue.
Yeah. Basically, breast cancer is the cancer of the breast.
Okay, wow, yes, we could say that too.
Yeah, guys, you heard that right? Abnormal growth of the tissues in the breast or something like that. So, what do you think can cause breast cancer?
Well, many cancers are caused by mutations of different genes. So yeah, you can have a mutation in a certain gene that can cause breast cancer.
Yeah. Like the what's the number of the gene? BRCA, BRCA1,
and
BRCA1, 2.
Yeah.
Yeah. So breast cancer can be genetically. Yeah, if someone in your family member has breast cancer, there's a chance you can also develop breast cancer. And that does not mean that if your uncle, your auntie, your mother, your father does not have breast cancer, that you won't develop.
True.
You won't develop the breast cancer. You can be the first one in the generation, so you never know.
Life.
Yes.
Is what it is.
Yes. And breast cancer can be, especially now if, let's say in first degree relatives, especially if it's your mother or sister that has breast cancer, there's now a higher chance of you developing breast cancer. I think around 34% chance of you having breast cancer. And especially if they're premenopausal. If your sister is premenopausal, if your mother is still under premenopausal, you have a higher chance of developing breast cancer. And if they're postmenopausal, then the chances reducing is also age. I think age matters. Do you think age matters?
Yes, it does, because okay, if we're talking about females, there's a certain age when some certain hormones are more active than when you're at another age. So
exactly, yeah.
before you reach menopause, your estrogen and progesterone,
Yeah.
you have a lot of hormonal
Exactly.
imbalances, and also you're at a more risk compared to someone who is postmenopausal.
Yeah. Basically, if after maybe menarche, when you see your what
Period.
period,
Your first period, between
Yeah.
the age of your first period to
uh-huh.
the last period.
Yes,
Yeah.
exactly. That age range. Basically, your hormones are very shooting.
Okay.
And what else do you think matters? Do you think diet and lifestyle matters?
I think it does because in these recent days we are seeing more cases of cancer, and we can all agree that our lifestyle is a bit sedentary compared to people who lived previously, and also exposure to like x-rays, and we have so much chemical and thermal radiation or what.
Radiation.
We have so much exposure to that. So yes, I think it does matter.
We no longer eat healthy food. We are eating everything that is already processed, stored. Yeah, guys, all these things matter. And what do you think? What do you think? What some factors do you think actually reduce the chances of you having breast cancer?
Let's see. I'm not sure this is scientific, but I feel like living a healthier life, choosing healthier meals, exercising.
Yeah, definitely.
Yeah, I'd say those.
And also, I think maybe screening. Do screenings.
Yes.
Yeah, do screening. Go to what's some of is there the doctor of breast? Is there
I don't
for
know.
them?
I think gynecologist.
Yeah.
A mammary gynecologist.
There we go, guys. You have it. Yeah, go get checked out.
Yeah.
Yeah, and if you can't afford to go get a professional checkout, definitely check out your body. Know your body.
True.
You'll see changes. If you remember, there's a video I talked about periods and pads and how you can DIY your pad, and I talked about this body. God made this body in a way that it can talk to us. So just learn about your body, and the changes that you see in your body, they indicate something. So I feel like if you actually know about the breast cancer earlier, it's better than knowing it at later stages.
Yeah, it's true. You can stop it from escalating, because when it escalates, it affects many other systems. Oh yeah, I was saying, if you don't get checked early, it can escalate and start affecting other symptoms, and your course of life now becomes like a downhill from then. But if you get checked early, you can get intervention very early, and you'll have a pretty normal life after that. So get checked early.
So guys, and remember, it's not just women can get breast cancer. It's not just people that we all have breasts. It's just the only difference is that female have lactiferous ducts, male do not, right? Or something like that, right? So we can all get breast cancer. So whether you're a man or a female, actually you can be the man and you help your girlfriend or your woman to check their breasts. Please, everyone, everyone should check their breast. It sounds weird, but it sounds weird, but it's actually that's how it's supposed to be. Just check your breast. And what is breast cancer awareness about? Basically, actually, that's
okay. So I feel like breast cancer awareness is first awareness to inform people that there's actually something called breast cancer that exists, and to help people know that now that it exists, this is what I can do to know that I have it or I don't have it. This is what I can do to know how to prevent, and also to celebrate with the survivors, cancer survivors who are out here battling breast cancer. We are just standing with them. I think that's even why we're in pink, because that's the theme for the breast cancer month in October.
Yes, and of course, to contribute, if you have family members that have breast cancer, or just visit them. Not just even family members, strangers. Go to a hospital, take something with you, visit them. That moral support. That what's the word?
Empathize with them.
Empathize with them. Yeah.
Now that you know what it is, you know what they are going through. You're in a better place to know how to handle them.
Yeah. So I think let's get to the juicy part. So are you ready?
Yes, I am.
So I think we should start first with a self-examination. So she's going to take me through self-examination. She's going to tell me what to do, then I do it on my breast. Guys, I feel we can do this together. If you are in your front, okay, yeah, let's do it together. As she said, whatever she's telling me to do, you guys also should do it, whether you're female or male. So guys. Yeah. What do you think?
Yeah, we can get started. So a brief preview. When you're doing a self-examination, you want to note any changes in your breast tissue. So it's actually best to do a self-examination before you look for a specialized person to do it, because you know your breast well. You know, are there any new changes that you're noticing? Hey, my breast hasn't been like this before, but now I'm noticing this new thing. So one, you're ideally be in front of a mirror for the first step. You have your shirt off and your bra off if you have a bra.
But sorry guys, you won't see all those things.
If you're male and you don't have a bra, it's okay. Just get your shirt off and then stand in front of a mirror. Make sure you straight your hands by your arms. Look at the size of your breast. Does the left one look like the right one? Although of note is many women, their breasts are not exactly as symmetrical. They can be asymmetrical. So for you, it's too large or it's a new difference, something you've not seen before. Initially, my breasts have been the same size, but now this one looks like it's getting bigger than this one. Not. You also look at your nipple. What's the color of your nipple? Does it look like it's becoming a different color, like orangish? Because that's a sign of something, a malignancy or something happening to your breast. Or is it getting scaly? Is it losing skin? Because people who have skin conditions like eczema can have that. Also look at, so we said asymmetry. You look at how equal they look like. Look if you can see any visible swelling, any visible mass. Also look at that. Any skin changes, that's important. Nipple changes. Maybe your nipple is always like this and now you're noticing it's coming back in, it's inverted. That's very important. Look at that. And then once you're done, you are now in front of a mirror, you are comparing. You can also try and lean forward kidogo. If your skin, if you had, it's called what?
Like retraction of the skin.
Like retraction or dimpling. When you lean forward, it's going to get exacerbated. So you'll see, okay, exacerbated is like, you'll now see it clearly.
Or even if you raise your hand and it also, like it also contracts the skin inside.
And then, there's usually the transfer hand raising. You can't even measure it. I didn't do a self-exam, so you chunky and done. What else?
You can also check the contour of the breast. Like, what's the contour, by the way? It's the shape the breast is shaped. Basically, if it also changes the direction of the contour,
now going this side and it's always like this.
Something is different. What else can you check? The color of the skin. As she said, sometimes you might also see at the nipple area, or I don't know if it's only on the nipple area or in part of the breast, you'll see like orange peel. If you know, you guys know the orange, how it looks like.
Something like that,
you actually see the like how an orange looks like.
Like your skin is dimpling and looking like an orange peel.
That's a very key point.
It's a cause of alarm actually. Get alarmed kidogo.
So is there anything else we can?
That's inspection, then palpation.
So guys, she's going to direct me into doing the breast test, and the guys, we do it together. We're doing it together. You have to examine
your left hand. Yes, put it on your head, and then using your right hand, divide your breast in 4 quadrants.
Like this.
Yes. Like this. And then palpate quadrant by quadrant. Feel for any abnormal swelling or mass.
So I have to go source for my armpit.
Yes.
So you guys, if you want to know the borders of the breast, so the breast extends from the second rib to the, I hope I'm doing it right as I'm talking. I can't multitask nowadays. You have to give the borders of the breast as I'm doing this.
What are the borders of the breast?
Then after one quadrant, I go to
the next quadrant. So it's better if you either move like this or move like this. You choose, but you don't jump from here to here to here to here.
So as you guys can see, I'm not lifting my hand from my chest basically. Yes. So I'm sorry I have a bra on, but it's really not comfortable. But if you're doing it on yourself, naked, and it'll be much easier. And yeah, as you guys can see, I'm actually like going in and feeling. So I think this is my last quadrant. So yeah.
Have you felt any abnormal mass?
No.
Okay, so you do the same thing on this other side.
Lift your arm. Start feeling the armpit. And also, guys, you also have to feel inside your this part.
Called supraclavicular, just above the
collarbone.
Collarbone, yes, collarbone.
It's also called, that one. So also feel in here and your armpit. Do not forget. So as I was saying, the borders of the breast, second rib to sixth rib.
Yeah. And
then in the midline of your armpit to the lateral border of the sternum. Yeah. But if you have bigger boobs, it can also go to, I don't know, the seventh rib. So if you have bigger boobs, instead of it going to the lateral border of the sternum, it can go to the midline, the mid sternum. Yeah. So just know your breast, and it's not a bad thing to have small or big boobs. Just they're both boobs. So just do the same thing, one quadrant after the other, and take your time. Just feel yourself.
That's so wrong.
Good.
Just feel yourself. So after she's done with that, if she had her bra off, ideally she's supposed to try and press on the nipple kidogo to see if there's any discharge.
Yeah, press. Yeah, like that.
Any abnormal discharge. Given she's not a lactating mother, we're not expecting any discharge. So if you see any discharge again,
either white, red, black, yellow, all those discharges are all not normal. So
yes. What else?
So let's talk about the observation again, and how will you see that the breast is abnormal?
Okay, so where Bonte
positions I can take to check.
Yeah, so standing like this with her hands at the side, she can see that. And then after you're done that, you can also stand like with your hands in the back. You will see that. And then you can also try and bend forward a bit to see any unusual skin dimpling, and also to compare breast size. Sometimes when you stand like this, you can't compare, but when you stand like this, you notice one droops further than the other one, and it's a big distance, so you notice that's not normal. Of note is that it's not every time that you see a mass or a swelling, it means it's a cancerous, or maybe okay, it could be a benign mass, and also it could be just a mass that's because you're in a certain time of your menstrual cycle. If you're female, there are people who get tender breasts with some few masses when it's their premenstrual period, or when they're menstruating, or when they're ovulating. So not every mass is a cause for alarm. But if you're in doubt, see a doctor.
Exactly. And of course, if you see anything changes, do not start panicking and killing yourself. Just go to a professional to confirm, and you can get the help that you're supposed to do. So what's next?
The breast exam.
So we'll do that. You're going to do the breast exam on me, right? So you can see my face. So
I'll ask her to just sit with your arms relaxed just at the side of your thighs, and then I inspect for any, are they symmetrical? Is there any, like I say, technically she should be without the bra in there, but we can't do that here. So are they symmetrical? Is there any visible mass that I can see? Is there any scar that I can see from here? Can I notice any change with the nipple, with the skin around the breast area? All that I need to look at. And then I also ask her to put her hands on this is where the waist, yes. Yeah, she puts her hands on the hips and pushes it inwards. Kidogo, yeah?
Okay.
Yes. That's done so that she can tense the pectoralis muscle. Yeah, you can check that up if you're really interested, you'll see. And then I still observe for the same things. The essence is to observe the breast under different positions. So I still observe, is it symmetrical? Can I notice any change in the breast, in the skin? Is the nipple discharging anything, or is the skin around the nipple or the breast any different? After that, now I'll ask her to lie down with her arms on the side.
Okay. Do I need a pillow?
Yeah, not naturally. You need to be on a flat place.
Okay.
And then, because she's laid down, again, we do an inspection when she's now lying down. Same thing. Breast, is it okay? The tissue, like I said, let me not repeat myself.
Yeah.
And then I ask you to put your hands on the back.
Like this?
Yeah. When she does that, she's exposing the entire breast, because we said there's some part of the breast that goes into the axilla. So now I can inspect better. I still do an inspection from that place where she is. And then I ask her to, okay, she should have done that, but it's okay. So now that she's here, we're going to palpate the breast tissue. We'll start with one side, then go to the other side. Okay. So now that I'm starting with this side, you can put your hand back, and this one stays like that, yeah? So technically my hands should be warm and I should have introduced myself, but I gained consent, which I already have. Yeah, so we divide the breast into 4 quadrants like that, yeah? And then we palpate quadrant by quadrant for any changes, any masses or any swellings that you can get. You notice my hand doesn't rise from the breast tissue. And then I also palpate the axilla.
Sorry for the sweaty axilla.
It's okay. The essence of palpating the axilla is the breast tissue extends to the axilla, so there could be a mass there that you can fail to see, and also because of something we call lymphadenopathy. If there is a problem in the breast or somewhere and it's moving via the lymph nodes can swell. That's why we also palpate here, and we palpate here, just above the collarbone. Yeah, so I can't feel for any mass. And then you put your hand back. Okay. And then yes, the same thing. Divide it into 4 quadrants and then go quadrant by quadrant. Like that. Then also the axilla. And then supraclavicular, you check. Are there any masses? You can't see any, okay, can't feel any masses here. If there are any masses in the person, you check for the mass. You know where it is. Is it in this quadrant, left upper quadrant? Is it on this quadrant? You know which quadrant it is. Is it moving? Can you describe the edges of the mass? How you describe the mass, you know where it is, its consistency. Is it a smooth mass? Can you feel it being smooth or rough? How do the edges feel like? And then yeah, the edges of the borders, how they feel like. And then to finish off, if she had her bra off, you ask her to press on the nipples to see if there's any discharge. And then after you're done, you report your findings if you're a medical student. But if you're a medical student, you should probably just watch your skills. Don't follow what I'm doing. And that's it. Yeah. Thank you.
Thank you,
TED Talk.
Guys, I don't have breast cancer. So guys, yeah, that's how you do the breast examination, and I hope you are doing it with us. So anything to add?
Something to add for every this is just a shout out to everyone who's been diagnosed with breast cancer before, yeah?
Yes.
And you're battling it.
Yes.
You're staying strong.
Yes.
That's really nice. Hang in there. Yeah.
You can do it.
Hang in there. You can do it.
Yeah.
I don't say we understand what you're going through, but maybe we don't because we're not in your shoes. But yeah, we're praying for you.
Yeah, so guys, and Breast Cancer Awareness Month, even if it's called the Breast Cancer Awareness Month, it's not just October. You can examine your breast any time of the year.
Yeah.
And you can go to a professional to examine any time of the year. You know, it isn't like breast just grows in October. What am I saying? We have breasts every day, so changes can occur any time of the day, any time of the year. So yeah, you just don't have to wait till October. Anyway, guys, yeah, I hope you enjoyed the video. Yeah, I think I'm going to enjoy.
I hope you learned something.
I hope you learned something, and so thank you so much, Brilliant, for allowing. I think you should be thanking me since you touched my breast.
Oh wow. Wow. It was an honor, Bont. That is so wrong. Anyway, thank you, Bonte, for having me.
No, thank you so much for coming. Thank you so much. Thank you so much. Okay. So this is my Instagram right here. Follow me on this Instagram and follow me on my Facebook here. So yeah, let's connect on the comments down below. And also, if you're shy to comment publicly, you know, just DM me something. And if I forgot something, please comment down below if you know something better, something
newer.
Yeah, comment down below. And guys, see you in the next video. Bye.
And don't forget to like and subscribe and hit the notification bell.
Ish. You guys got that part, right? Because you cannot miss out these videos. So yeah, and don't forget to subscribe, join the farm, join the squad, and we shall all be happy.
Yeah.
So guys, see you guys in the next video. Bye.
Toodles.